Hello, everybody. This is Susan Rosen, and I am here with a guest who's been on the podcast before and actually is going to be a more regular guest on the podcast. And her name is Dr. Cris Azzola. I'm not sure, did I get that right, Azzola? Okay.
Absolutely.
Okay, good. And Cris is a naturopathic doctor here in San Francisco. And I know we had a really good chat the last time Cris was on. I will put a link in the show notes back to that one if people want to go back and take a look at that. And Cris is, I should say she is a licensed naturopathic doctor, which does make a difference. She is a descendant from a long line of physicians who believed in balancing conventional medicine with natural healing techniques. And she was, from early childhood, inspired by her family's dedication to helping others and became curious about the natural remedies her family used to stay healthy and help others stay healthy, and was always wondering how grandma's stuff worked. And so that's why she decided to go the naturopathic route instead of the traditional MD route, whatever. And so I want to welcome Cris to the show.
Thank you. Thank you for having me.
Yeah, and I wanted to let everybody know that what we thought we would talk about today is how we can help to detox and eliminate a lot of the toxins and the waste in our bodies that we all accumulated after the wildfires this year. So I know that we had, I think a lot of them were here in California and on the West Coast, but I know there were some in some other parts of the country as well. Mm-hmm. And I also think that there's a lot of other kinds of environmental toxicity going on out in the world. And so that's the whole area that we're going to be talking about. And I'm pretty sure that this is going to be providing some valuable information for everybody to use, especially these days. And I have no doubt with all of the stuff that they're going through with the snow and the cold in a lot of other places in the country right now, I know they're having problems with drinking water and a lot of different things. And I think this all kind of goes up into together into that whole environmental and metabolic detoxing. Mm-hmm. So welcome, Cris. Now that I've just, gone into all of this detail. So why don't we start out by, and maybe you can tell us all how environmental pollutants affect us and why should we be worried about them? I mean, I know a lot of us are, but why behind, what's the why behind all of that?
Yeah, so we're all exposed every day to small levels of things, it's just a part of living. There things from paints and gasoline and just the air. The challenge is this year, especially in California, we have been exposed to a lot more than that, the higher concentration for more like as a couple months, as opposed to these small level toxin exposures that our bodies are, unless they're overloaded, pretty adept at processing and just getting out at small levels. So a lot of the studies that are done for toxins are done for industrial exposure, people who are actually working with these things on in massive quantities on a continual basis. So we do have a lot of research in that, and there is a really rapidly growing body of research talking about what a smaller level chronic exposure is doing to our bodies. And consistently throughout that research, it's become evident that, especially when it comes to our immune system, our nervous system, and our endocrine or hormonal system, these systems in particular are more impacted
Mm.
by these chemicals. And so our bodies, trying the best and most efficient way to process them, often do a great job. But of course, when overloaded, there are challenges with those processes, and they then can impact those systems more profoundly. And so, what I wanted to highlight today is that what are the regular ways that our bodies deal with small exposures and keep those things moving so that when we are exposed to larger quantities, we are starting from a healthier place to deal with them, if that makes sense.
Mm-hmm. Yeah.
Mhm.
Yeah. No, that makes a lot of sense. So, um, out of curiosity, I know in years past we've had a lot of these same, I mean, obviously the as time has gone on, the wildfires have gotten worse. Um,
Mhm.
they're they're now all up and down the West Coast. California doesn't own them all. We just happen to be a bigger state. But it's how much of an impact, since this was during COVID that we had the
Mhm.
last ones, right?
Mhm.
How much of an impact or how much of a help was it that a lot of us were walking around with masks on because of COVID? Do you think that actually helped?
I think it's my experience that with a well-fitting N95 mask, it
Mhm.
did really filter out. A 95 means it filters out 95% of the
Mm,
particulate matter and gases that you're breathing in. The
mhm,
challenge is that most of us don't wear them because when you fit them extremely properly, they're very tight and they don't allow us to breathe very easily. So if you're exercising or moving about your regular day, the challenge is keeping it on so we can breathe more freely but have it well fitted. And that's usually, uh, those are usually competing things. So most of us don't wear them properly, or it's very easy for them to come off. The other thing is with the N95 masks is that if once they get wet, they're
mm,
no longer doing their proper function. And so wearing that's one of the challenges of wearing them consistently day after day is you're likely to sneeze in them or do something that will
mm,
decrease their capacity to function. So they need to be replaced quite frequently. A lot of us, of course, if you have well filtered air indoors,
mhm,
staying indoors definitely helped during that time. The masks, the face coverings that we're wearing for COVID are not filtering. If you're not wearing something like an
mm,
N95, it is not helpful with those exposures. So that's, I would say,
mhm.
was the biggest challenge is of course, there was a shortage and many people were not
Yeah,
able to make use of them.
yeah. Oh, absolutely. I have some of those I've gotten those, actually, I think they're P95 or
Mhm.
P2.5 or whatever, the filter things that you
Mhm.
put inside your mask.
Right.
So we've been using those. I just bought a whole, you know, huge package of them. And and every couple of weeks I change it out, take the old one out, put a new one
Mhm.
in. We don't go out that much. So other than our walks, and
Mhm.
then half the time we're not wearing our masks anyways, unless we're
Mhm.
gonna be close to somebody. But yeah, and maybe that's that brings up a similar, or not the right word, anyways, related question. Are we getting toxins, for instance, from the fires and stuff, even when we can't smell the smoke? Or sometimes are we smelling the smoke and there aren't any toxins in it? I mean, how do those two things connect?
So it's a great question. The the smelling of the smoke is not necessarily directly related to how toxic the smoke is. For example, part of the wildfires was carbon monoxide.
Mm.
It's just something that is a natural byproduct of wildfire smoke. The challenge we had this year as well is that houses and cars also were part of the, so now you're introducing chemicals, plastics, a lot of pesticides. They're maybe in smaller quantities, but they're still present.
Yeah.
So the air quality index was one great way to at least see to track particulate matter.
Mm-hmm.
And I don't know about you, but there were definitely days where I thought the air was seemed clear to me and I couldn't smell it. But then when you looked at the quality index that the
Yeah.
EPA put out, there was a
Right.
very different reading. So that is a help and a gauge, more than our noses sometimes. And definitely the carbon monoxide being not having any odor is also a challenge. So they're not necessarily related. It's not something you can count on 100%. But for sure, when you can smell it, you know there's a problem. That's for sure.
Yeah.
You just don't want to wait until that point to put on your mask.
Yeah. Well, I know for myself, there were a couple of times where it was seemed very smoky.
Hmm.
You could really smell it strongly when I would go out for a walk or something. Um, and yet when I did go to the EPA and
Hmm.
their thing, it wasn't a real high. Eventually it
Hmm.
got higher, but there
Hmm.
wasn't a real high thing at that particular point, which I thought was kind of interesting. But I mean, with my allergies and stuff, I couldn't, after a little bit of time smelling smoke, I couldn't breathe very well.
Hmm.
Um, so
Yeah.
that's, it's, I don't know whether there's a lag.
Sometimes there is, and it depends on the sensor. And in the Bay Area, we have so many dips and hills and valleys. And I did find that there was a discrepancy for some of the time. And you just waited a little while and then you can see it reflected. Having a really great filter at home with
Mhm,
a sensitive filter sensor that can tell
mhm.
you is a way to also know
Interesting.
what's going on closer to you.
Uh-huh.
And there are specific filters that work with smoke in particular. Not all filters filter smoke, but there are apps now these days that tell you exactly what particulates and what uh, components are in your household air. Because
Oh,
that's
wow.
another thing is sometimes our indoor air can be more polluted
Yeah.
than our outdoor air, especially on a fresh day, because we have gas stoves and paints and furniture and all sorts of things. So airing our places out,
Yeah.
often bringing in that fresh air, like grandma said,
Yeah.
is actually a good thing for our breathing when the air is nice and fresh outside.
Yeah. No, that makes a lot of sense. That makes a lot of sense. Yeah. Um, yeah, because we open the windows a lot during the summer, which is when we typically have all the fires. We'll open the windows at night
Hmm.
and to cool the house down.
Hmm.
And there were a number of times, actually, where we didn't leave them open all night. We would close them
Right.
before we went to bed, or we'd have them open, and then all of a sudden we'd start smelling the smoke, and we'd run around the whole house and close all the windows.
Yes.
um, so it was like a game, you know. It was.
Yeah.
I mean, we have air conditioning, but the air conditioner's outside,
Hmm.
right? That's where they usually are.
Yes.
Um,
Yeah, and I definitely this was a time to see how leaky your house is too, because there are nooks and crannies and things like that that can bring in, and sealing those can be quite important, especially during the heaviest or the highest pollution of those days.
oh, what a good idea. Okay. Yeah, we're real lazy about any of that kind of stuff. Other than getting rain leaks and stuff like that. Those we
Yeah.
take care of real fast. But so let's talk about um, what are some of the things that we can do to help get rid of or flush out, whatever the right word is, some of these toxins?
Yeah, so I'm going to add in there are these environmental toxins and pollutants that we take in.
Mm.
Then, just to also add to the fact that our bodies, as they function, create waste products and materials that also need to get out of the body. So that's part of why we want to keep our elimination functions. They're called emunctories in certain medical systems. We want to keep those channels open and flowing so that we don't bog them down and suddenly there's an unexpected thing the body has to deal with, and then it's bogged down doing these other, it doesn't filter out normal waste from our tissues and cells well, and so then you add this additional thing and it's not
Mm.
functioning as it should. It's overwhelmed. So some of the main ways that we eliminate any type of waste material from our bodies are through the digestive tract, through the urine, and through the sweat. And so part of the digestive tract, obviously, we have the stool that takes waste products out, but the liver is the primary organ
Mm.
in the digestive tract of processing our toxins. And it's a very complex intelligence system with many phases and reactions that it does. But it either takes toxins from the environment or from our bodies and puts them in the stool or processes them so that the kidneys can excrete them.
Oh.
And part of that, one of the reasons that we recommend eating a lot of fiber for people is that these waste products, when they're headed towards the stool, they go into the bile and they get stored in the gallbladder until it's time for it to mix with food and everything and get taken out of the body. So these are called bile salts. And when we eat fiber, for example, a good high fiber whole grain diet, the fiber attaches to these toxins in the bile and takes them out of the
Mm.
body. They're kind of like a sponge, but
Oh.
if we don't have a high fiber diet, they just get reabsorbed and recirculated back into the body.
Oh,
So
wow.
you never really get rid of them. They're just kind of hanging around. And I've had people say they just kind of feel that they don't feel really sick, but they don't feel energetic or they feel kind of sluggish. And
Mm.
sometimes moving that digestive process along can really help increase energy and vitality and just overall uh, wellness. So
Mm.
that's critically important. And then for the toxins, for example, although it's a low level pollutant in the wildfires, but even on a day to day, we get exposed to benzene
Mm.
from gasoline or paint. And so that was in the wildfires as well. And benzene is processed by the liver. If toxins don't go out of the body right away, some of them accumulate in fat. And so, yeah, so that
Oh.
is the body tries whatever it can to get it out of the bloodstream and away from the nervous system and away from other critical body
Oh.
systems.
Wow.
So then it's a little bit harder to get rid of them once they do that. It's not impossible, but then you got to do a little bit more work. So the liver processes them, and benzene is processed so that the kidneys can take it out quite quickly within a certain amount of days.
Mm.
Or it's a very quick process. So going through the kidneys, if that system gets overwhelmed, let's say you're not drinking enough water or you have kidney impairment, then the processes they create these byproducts that are then excreted through the lungs. Like it just tries any way to get it out. But again, it's not the easiest way to go. It's kind of like a last resort. So things that going on that system of the idea of flow, you want to keep your kidneys flowing as well, drinking plenty of plain water, making sure that you urinate 1 or 2 hours, that your urine is relatively clear or pale yellow. And so, yeah, those are the two main ways that we excrete any kind of waste product out of our bodies that we take for granted, frankly, but are very sophisticated and important functions.
Yeah.
And then the third way that we do is through our sweat. And that's one of the ways that fat soluble toxins do come out of our bodies. When we sweat, we have a water component and we have a fat component as well that comes through our glands, our sweat glands. So it is important to get moving and make sure that you get, right now, a lot of us don't have access to saunas, which would be a great thing for this. But in the meantime, we can go out on walks and at least try to work up a sweat while we do that. And ideally, when you come home and you've built up a sweat, you shower these things off so that they don't get reabsorbed back into the body.
Excuse me, I'm coughing while I'm
Are you okay?
yeah, just all of a sudden got a funny, it must be talking about all the toxins and the stuff.
Oh.
I don't know, just all of a sudden it was like, ooh, okay, that's interesting. I think it's just allergies. Okay. So, well, that's really interesting. I think that most people don't, including myself, don't totally understand or didn't totally understand how all of this works until you gave such a great explanation of it. Because we hear about it all the time, right? In the news and whatever, and they're always talking about this and all the magazines and all this kind of stuff. But it doesn't go into, well, this is how it works and this is why you need to worry about it.
Mm-hmm.
Which I appreciate you doing that for everybody. I know it was huge for me. So
I'm glad. It's my pleasure.
so tell me, since most of the people, not everybody, but most of the people that that listen to my podcast are older, over 40, over 50, whatever. What parts of that process are we most at risk of, getting slower or getting harder or whatever? And what can we do about that?
Yes, there are our the main systems that slow down are definitely digestion. And so just our overall capacity to process, even our appetite can decrease over time.
Mm.
So that is one way. And the longer we're alive, the more things we're exposed to. So the liver has been working for a long time and it might need extra support, just like the digestion as well. The kidneys, again, they're susceptible to having too much salt and not having
Mm.
enough water. So kidney function also is one of those things that tends to decline with age and not be as efficient.
Hmm.
And then lastly, it's the immune system. Our immune
Mhm.
system is not as efficient, and it just loses some of that vitality that it had when we were younger, and doesn't respond as well. So needs to be supported more. So those are the three. I would say digestion primarily, kidney function, and immune system. And then of course, hormonal system is always challenged by what's happening in the other systems and their hormonal changes, and that also impacts the other systems. There's more and more research showing how hormonal changes impact the microbiome. So the digestive makeup of all the bacteria, beneficial or not, are impacted by hormones and their fluctuations. And it's a really
Oh,
exciting new area where we're learning more and more by the day.
interesting. Okay, so is that, well, obviously for women, but is that for men as well? Are there hormonal issues? Um,
You know, I have recently most seen the new research on women, but
mhm,
it doesn't. The hormones, women do produce testosterone as well, and
mhm.
um, make use of estrogen, as do men have their similar fluctuations that might impact. But I would say more research will come out about that
Mm.
in particular. But it's pretty safe to assume that the changes will be also
Mhm.
happening.
Yeah, no, that would make sense. I mean, I know there are some things that only we get, but
Hmm.
I think overall for something like this, it would make more sense for it to affect everybody,
Hmm.
especially as they get older, for sure.
Yes. And one of the things about environmental chemicals, plastics, a lot of
Mm,
the pollutants or just things we interact with on a daily basis, even in our uh, furniture or our day to day products, they do have a very estrogenic
mhm,
appearance to them in chemical structure. So, one of the risks for men is that they are getting exposed to these levels of estrogens that are not, they're like more excessive for their bodies than they would
mhm.
in the past before we use these, they'd be exposed to. So, again, having a good system of detoxification is good there so their bodies don't get overwhelmed by estrogen.
Uh-huh. And so other than just the water and um, you know, watching your diet and that sort of thing, are there any specific things that you could recommend that people kind of do or watch for or maybe add to their diet, maybe some kind of a vitamin or something? I mean, what can we really do to ward off some of this, because some of it just kind of stays in the atmosphere too,
Mhm.
once it's up there.
Yeah. So, just I am going to go sticking with the diet just for a moment.
Mm,
R- I don't think it's very well understood that sugar really can impact liver function, excess sugar in the diet, as well as really impair immune function cells. So, our immune cells are basically can be, some studies have shown, paralyzed for several hours after eating something really high in sugar.
oh
So,
wow.
that's one of those things where having really great fruit and vegetable composition of your diet is great because those are not artificial sugars. Those come with a lot of vitamins and also fiber when you're eating them, and it's more additive to your body and your system than having excessive sugar. So just keeping that in mind, and there are recommended limits, daily limits for how much
Mm,
sugar we should have for men and for women. So that's one of those things. In terms of supplements, I think there are many supplements, especially if you've had high exposure.
mm,
We can target as naturopathic doctors and integrative medicine medical specialists that focus on environmental medicine. Once you've been exposed, there are certain nutrients and supplements that definitely take those specific toxins out of the body. For example, vitamin C can chelate,
mm,
otherwise known as just rid the body of certain metals. And that's something you want to do with supervision, and seeing also how high the level is, because sometimes it's appropriate to do on a slow basis. Sometimes when the exposure is built up so high, you need to do much more high intervention
mm,
treatments. From an herbal perspective, luckily, the things that we're used to using and our culinarily really help us with not only our digestion, but our immune system and our detoxification processes.
mhm,
One of my favorites is garlic because it is what's called a carminative. It helps us break down foods and fats, just helps move the digestion along.
mhm.
But it's a powerful antioxidant and
Okay.
also a preservative and antimicrobial.
Mm,
So if it's something you enjoy eating and you don't mind sprinkling it on lots of foods, then it's a perfect carminative or herb to
uh-huh.
use. And so are the more potent thyme, garlic, rosemary, things like that.
Oh.
Also, many of us ingest teas, chamomile tea, mint tea.
Mm,
These are brilliant things to use on a regular basis if it's suited for you, because they not only help you digest, but it helps overall with the nervous system. It kind of calms the nervous
mm.
system gently and keeps, again, the flow of your bile and your uh, musculature and your digestion going as well. So they are gentle but powerful, especially when used on a regular basis.
Huh. Okay.
And but yeah, there are lots of nutrients and vitamins. The challenge with making recommendations is it depends on each individual's
Right.
nutritional status and their conditions.
Yeah.
One example is someone who's having an active flare up of diverticulitis should not be ingesting a lot of fiber. It's actually uh,
Ah,
really irritating to the digestive lining while they're having that flare up.
uh-huh.
So that's where, if you have an underlying condition, it's great to work with your doctor and using these larger quantities of supplements. It really makes a difference to tailor it to the person.
Yeah, that makes a lot of sense. I know just my own experience. Um, I was taking a lot of vitamin C and developed an did they call it an irritable bladder issue? Um,
Mhm.
I guess bladder. I don't know. Anyways, it just like always hurt to go to the bathroom.
That's a great reminder. Yes, if you have taking these supplements, sometimes you can form kidney stones from them. So,
Ah,
in working with patients, I often look at their history. Are you a, do you have a tendency to form stones?
mm,
You might, it's always a good idea to get a baseline and take a look at how there are liver function tests. You can see how efficiently the liver is working, do a urinalysis, take
mm,
a look at these systems and how they're functioning first before you make a recommendation for how to proceed. And of course, looking at what exposures and what current health conditions they have, and make a comprehensive plan that way to address the issue.
mm-hmm. Yeah. No, that makes a lot of sense. Yeah, because I mean it's so easy to cause problems without even realizing
Hmm.
that what you're doing could end up with that, you know?
Yes. Yeah, there are a lot of, even though they're sold over the counter, there are contraindications to supplements, and
Mhm.
definitely herbs and high dose vitamins. There are
Yeah.
contraindications, and we definitely want to do the you want to give enough to, if you're treating a particular condition, but be aware of how much is too much, and then also monitor it in someone to make sure it's not too much for them,
Mhm.
because that also makes a difference. We're all individually set to take in a certain point
Right.
or a certain amount of
Uh-huh.
these
And that can
supplements.
change too, right?
Absolutely.
Um,
Absolutely. As your body recovers from something, or maybe some
ah,
other condition comes up. One example is vitamin C that you mentioned. When we
mhm.
have a cold, our tolerance for ingesting vitamin C goes up dramatically. But
Ah,
as you get better, then you begin getting looser stool from the same amount, and then you have to cut back. So that's for one example of our body starts to take in what it needs and then stops after a while. You know,
uh-huh.
and vitamin C is it does produce quite a reaction in people. It's uncomfortable, but it's relatively benign. But definitely not all vitamins are that responsive. So that's why you need training to make sure you know what to look for in terms of when the side effect of something being too much.
Right, right, right. Or with something else that you're taking, right? It can
Exactly. Yeah. Thyroid hormone is a great example too. There are
mm,
many uh, thyroid hormone is interacts with a lot of supplements, so you really want to take it apart at least 3 4 hours away, especially from particular supplements. Or a lot of medications, if you're taking it with fiber, are not going to be absorbed as well. So that's again why you want to check
okay.
in with uh with your doctor or healthcare provider to
Yeah.
make sure that it's safe to do this combination, and maybe what the adequate amount of spacing is to take in these things if you need them.
Yeah, no, that would make a lot of sense because and particularly obviously if you have some sort of an issue, but for sure around any sort of these toxins and toxicity because so many people self self prescribe when it comes to
Right.
vitamins and all that kind of stuff. And not everybody knows about the things that you were just talking about. They take them all in one handful once a day, and
Yes,
and some things don't. They negate other things that's in your hand, and
that's right. That's right.
yeah, yeah, I've found that myself. So yeah, interesting. Well, I think maybe we should probably call it a day, unless you have something that you'd like to kind of do a little wrap up
Yeah,
around
so
on what we talked about.
to wrap it up then, that would be great. Just think of the concept of flow. Keep things flowing. As the waste materials and toxins move out, it makes a lot more room for nutrients to move into the body and for the healing and repair that we naturally do on a regular basis that our bodies need to do. So waste out, flow of nutrients in. And the way we do this is through the digestive tract, the urine, and then the sweat to keep those things flowing and moving. And then the last thing I do want to bring up is making sure that you're not taking in and ingesting too many toxins as well. And that includes things like the environmental pollutants like pesticides from foods.
Mm,
And I think you mentioned before, you talked about the clean 15 and the dirty dozen.
right.
Some foods, typically every year, the environmental working group comes up with a list of foods that are not sprayed with a lot of pesticides. So if you don't want to buy organic, these things are perfectly fine to
Hmm.
eat, and you won't add to your exposure through the diet. And then there are dirty dozen where it does change every few years the amount of the foods that are most likely to be grown with these items. And the better we can get at not ingesting them through our digestive tract, then gives us more room to deal with
Hmm.
other things that we're exposed to.
Yeah, yeah. No, absolutely. Um, as you say, I think I did a podcast about that. Actually, towards the beginning of when I started podcasting, but I will put that in the show notes, and I will also put a link to the environmental working group so people
Great.
can go and because they're great, and not just for food, but they talk about soaps and detergents, and I mean just
Yes.
um, anything that we use or have in our houses or whatever. So it really is a wonderful reference site for
Hmm.
everybody, just to keep up
Yes.
in their list of what to go look at. And I know with the food, I've always found it very interesting that the cleanest one for years has been the avocados.
Yes.
That people can't. They've done tests and studies, and they'll take one that's um, organic and one that isn't, and they can't tell the difference from
Very
them.
interesting. Yeah.
Yeah, yeah. So that's the one thing that I always remember, and so I don't waste my money buying organic avocados. I mean, I hate to
Yep.
undercut any of the farmers that are doing it, but don't bother. You know.
Another one like
Mm.
that is garlic. Nothing
Okay.
really wants to eat a garlic, so they don't really spray garlic. So
Uh-huh. Uh-huh.
it's so potent. I don't think any microbe really wants to get near it,
Yeah. Yeah.
or any insects. So that's another one. But avocados are wonderful. They're actually massively. I was surprised when I started doing research on the fiber content of food.
Oh,
What a high fiber food it is.
yeah.
So definitely gonna get my guacamole in this weekend, hopefully.
Yes, exactly. Exactly. Yeah. Yeah. No, avocados are wonderful in everything, and I just eat them plain, and yeah. I love avocados. Avocado oil is pretty good as well, but you have to that you have to be more careful. It has a high level of rancidness. I don't know what the right word is, but um, they have found, even with the organic ones, that
Oh,
that
okay.
they've got a lot of toxins in them, actually more than the non-organic ones, and has something to do with the way that they um, make it.
Yes.
The processing.
Yeah. Well, I do feel like we could probably have another segment and talk about, how to cook your food so
Yeah.
that you maximize the antioxidant qualities while not burning the oils and adding. That's another way that we get and we ingest toxins or,
Yes.
problematic things that then our body needs to process by burning our oils or using rancid oils, and that adds
Hmm.
to the
Yeah.
processing
Yeah. Yeah.
capacity we
And
need to
some of them
do.
don't do well with high heat, like olive oil.
Absolutely.
You know,
Yes.
so many people, oh, I'm going to fry it up in olive oil. It's like, no, don't do that. Please don't do that.
Yes.
But anyways, I think you're absolutely right. Let's do that in another podcast.
Wonderful.
There you go.
Wonderful. Well, thank you
So,
very much
hey,
for
thank
having me.
you. Thank you. Thank you. I always enjoy our talks. So
Same here.
thank you. And I am going to say, as usual, that I am not a doctor, although Cris is a doctor, but nothing that either of us has said or talked about is to be seen as medical advice, because we don't know what your particular, and Cris in particular does not know what your specific issues are. And so none of this is to be seen as prescriptive. And if you are having any problems, please go see your own doctor or go to the emergency room if it's at that level. And I think that's about it. And we will see you again on another podcast.
See you next
So,
time.
yeah.